Alex Berezow is a PhD microbiologist. He has spent the last 9 years in science communication, and he has written over 1,000 articles, many of which appeared in news outlets such as BBC, CNN, Wall Street Journal, The Economist, Forbes, The Telegraph, The Atlantic, and USA Today. He has also authored and co-authored 3 books. Previously, he was founding editor of Real Creations. Currently, he serves as vice president of scientific communication for the American Council of Science and Health, a consumer advocacy non-profit whose mission is to separate media-hyped health scares from legitimated health treaties. The topic of his talk today is alcohol myths. Don't fear the beer or say Nein to wine. Sound interesting?
Thank you. Thank you for inviting me. So I work for the American Council on Science and Health, which is a consumer advocacy nonprofit that was founded in 1978, way before I was actually born. And we were founded to debunk junk science and phony health claims. And so mostly they're found in the mass media, particularly the American mass media and the British mass media, which are both in English and I can read. I assume that it's bad in other languages as well. We promote sound research and evidence-based policy, and so we sometimes endorse positions which are not popular, but we believe they're scientifically sound. And we like to think of ourselves as crime fighters. We fight crimes against science. The organizers wanted me to talk about the funding. We're a nonprofit, but we are funded mostly by individuals and private foundations. We get just a tiny bit of our money from corporations and trade associations, and then there's a tiny fraction left over from NGOs and like that. Okay, so the media likes to exaggerate, and I've spent the last 9 years combating this. The New York Post ran a story, and this is just a small sample. Like, you could go to the New York Post right now, and I assume you could find 10 of these that are just like this, okay? So how scientists are going to bring dinosaurs back to life. Another one, a congresswoman in the United States says the world will end in 12 years. She's absolutely right. In that case, we should probably be drinking more beer, not less. The Sun from the UK said that, guys, you better watch out because beer may be giving you man boobs. So this is the diet that Americans and British people, at least, are fed on a regular basis. This is why public understanding of science is so poor, because when people open the newspaper, this is what they read. So from politics to health, the media encourages exaggeration because it provides them with more shares and clicks. The only thing they really care about is revenue, their money, and your eyeballs. Whether or not the story is accurate or ethically written or responsible is of complete secondary concern. Simply put, there's no incentive to write anything that's reasonable or nuanced because no one will read it. And so that means people, including scientists, unfortunately, are incentivized to make outrageous claims. The more outrageous, the better, because the more attention you'll get. So who's to blame for articles like that? This is another story from The Guardian. Yes, bacon really is killing us. Okay. So who's responsible for something like this? Well, the journalists and the editors themselves are responsible because they have almost uniformly no training in science whatsoever. They're seeking website traffic, so that is a much more interesting headline, bacon is killing us, rather than saying maybe you should limit your bacon intake to 1 piece a week or something. That's not interesting. So bacon is killing you is a much more interesting headline. The university press offices are surprisingly a part of the problem. They have an incentive to get researchers' attention because it translates into broader impacts. If you're applying for an American grant, you want to see your research makes it into the news. Well, the way you do that is you hire a press officer at the university to hype your research. So they're incentivized to exaggerate. Unfortunately, scientists themselves seem to be interested in going beyond the data at times because it's in their interest for getting more attention and getting more research funding. And then the general public itself doesn't understand science. They like drama. Tune into Fox News or CNN, or you pick a news source and you see people screaming at each other, and that's essentially the sort of debate we have in science as well, at least in the mainstream press. Okay. So it's really no surprise that the media hypes alcohol. Why not? Everybody drinks it, or most of us drink it, so we might as well have insane headlines about it. So on the left you have how red wine prevents cancer, and the top reasons beer is actually good for you. Now look at this one. The how red wine prevents cancer is actually from the University of Colorado's press office. Okay, so that's a nonsense headline directly from academia. And then Fox News, the top reasons beer is actually good for you. Well, I mean, to an extent, right? Maybe one, as we saw from the J-curve, not 10. Then on the other side, we have The Guardian. An extra glass of wine a day will shorten your life by 30 minutes. That's not good. And then, of course, the BBC study, which we'll be talking about. I'm sorry, the Lancet study covered in the BBC, no alcohol is safe to drink, a global study confirms, which Dr. Costanzos talked about, and I'll talk about that again. So what's the public to do with things like this? Well, there has been something of a new Puritanism in the 21st century. It seems to be going... humans are attracted to vice, right? We like to smoke, we like to vape, we like to drink, we like to try marijuana, we like to do all these things. And now there's this backlash against it that, no, you shouldn't vape, no, you shouldn't drink, you shouldn't do anything. And so there has been an effort by some scientists to show that moderate or even any alcohol consumption whatsoever is bad for you. And I think the studies are exaggerated. I think that they're oftentimes poorly performed, or both. And so there were two that made huge international headlines that I wanted to talk about, and the problems that I saw with those papers. The first came out in the Lancet, and this is what, not this one, but I think the next paper is the one that I cite, Dr. Costanzos. Alcohol use and the burden for 195 countries and territories. The basic conclusion of it was that the level of consumption that minimizes health loss is 0. So you cannot, a single drop of alcohol will raise your risk of death or disease. Alcohol control policies, therefore, might need to be revised worldwide, refocusing on efforts to lower overall population level consumption. Now, there are two problems with this abstract right away, right? The first statement is the level of consumption that minimizes health loss is 0 is actually not even supported by their own data, and I'll show you the figure where that is contradicted by their own paper. And the second statement is a political agenda, which is we want to reform how people drink in the world. Okay, we can have that discussion, I suppose, as scientists, but that involves economists, it involves politicians, it involves a lot of people, and they're putting forward a political agenda. And so that automatically sets out red flags for me as a scientist when I'm reading someone else's paper. So why is the study flawed? Well, the statement, the level of alcohol consumption that minimizes health loss is 0, is simply not supported by their own data. If you look at the graph here, the confidence interval, so they are plotting standard drinks daily on the x-axis, and on the y-axis is relative risk, and it's the relative risk of anything. So anything that can go wrong in your life, Alzheimer's disease, lung cancer, car wreck, you stab somebody because you got mad, anything is considered a part of this relative risk calculation. And they say, well, lo and behold, if you drink anything, your risk of something bad happening is higher than if you don't drink at all. Unfortunately, that's not true for one drink. One drink, the confidence interval actually includes 0. Or 1, includes 1. So that means there is no health effect at one drink. But that's not what they said. They said that you must not drink alcohol. That will minimize your health impacts. So that's one big problem, was their data didn't support their own conclusion. The second thing is that the data actually included car crashes, acts of violence, people doing things that were just flat out stupid, and then they attributed that to alcohol. I don't know if that's exactly a fair thing to do. We're looking at health impacts from alcohol, not binge drinking and then doing something stupid, but that's what they included that in these figures. The other thing they did is they used something called the daily, which is very common. The World Health Organization uses it. It's widely used. It's known as the disability adjusted life year, but I think it's a flawed metric, and I'm not the only person who has a problem with the daily. If you're unfamiliar with the daily, the way it's calculated is, let's say that the average person is supposed to live to be 75 years old, and you come down with a disease at age 70, and then you die at the expected age of 75. What were your disability adjusted life years? Well, you can't answer that question directly unless you know what disease you had, okay? So what they will do is they will weight your disease based on the severity of what they think the disease is. So 0 by this weighting system is completely healthy, and 1 is completely dead. So anything in between is, 0.4, you're 50%, you're 40% dead, okay? Now we laugh, but the World Health Organization does this. This is how they calculate these things, okay? I was just curious of what some of these weights were, so I looked on their table. Congenital urinary incontinence, so if you are unable to control your bladder, is rated 0.139, so they consider you 13% dead. If you have migraine headaches, I actually have a migraine headache. I woke up with a migraine today. I have medication for migraine headaches. The World Health Organization considers me 44% dead. So I would be weighted right now. They would say that, you, Dr. Berezow, you've suffered migraines all of your life. Your quality of life is, equivalent to someone who's halfway, got 1 foot in the grave, essentially. I have a problem with that. I guess namely, that I don't think it's that big of a problem for me. Ebola virus, 0.13. I don't know where they come up with these numbers, but these are the numbers that are used. And then they take these and then they calculate health effects from them. Now, someone who's a lot smarter than me can weigh in on whether or not this is a legitimate method. I see a large dose of arbitrariness in these numbers, so I have a problem with it. Another person who has a problem with it, Sudhir Anand and Kara Hansen, also wrote a paper back in 1997, because that's how long these things have been around. The daily's been used for 20 or 30 years, and basically saying that there is no information reported which would allow an assessment of the statistical or scientific basis for selecting the weights. So I've never yet heard an explanation of what these weights mean or how they're derived, but there you have it. So I wasn't the only one who had a problem with this paper. There were many people who had problems with this paper. Dr. Augusto di Castelnuovo wrote that the way the curves were combined was not valid. It contains a dose of arbitrariness. The authors do not explain why heart failure was not included, and why dailies were even used as the variable of the variable of interest. And they did not take into account the variability and precision between curves because they were derived from different sample sizes. So a sample size of 100 versus a sample size of 10,000, you have different statistical methods you have to use for this. They didn't take that into account. Dr. Shield and Dr. Rem wrote that if relative risks are weighted by the use of the lifetime abstainers dailies, a slight protective health effect of 20.8 dailies per 100,000 people is observed. And we've talked about that here with the J-curve. They disregarded that information. Dr. Arna Ostrup, Dr. Ramon Estruch wrote that we are surprised on the basis of mainly ecological data. If you're not familiar with the term ecological data, that means there are no individual measurements. You just say that society as a whole drinks this much alcohol and there's this much car accidents, therefore A causes B. That's ecological correlation. It's not wonderful, but a lot of epidemiological research is done that way. They say that that's not sufficient here to make a massive revision to alcohol control policies. This in particular is interesting, this criticism, that if you look at the estimated dailies, it's 918 in 100,000 people for people who drink one alcoholic drink per day, and it is 914 per 100,000 for non-drinkers. So we're talking about an increase of 4 per 100,000. So I mean, I can't do math in my head, but that's a fraction of a percent in difference in relative risk. Okay. And then finally, another criticism said that most of the 23 health outcomes they studied, including stroke and heart attack and cancer, are diseases associated with aging. However, the authors attributed them to alcohol rather than to longer lifespan. So these were some of the criticisms, and this one they concluded by saying this is a political instrumentalization of the journal's reputation, which is not a very nice thing to say, but I also think it happens to be accurate in this case. Okay, how did the authors respond? By the way, this research came from my alma mater, the University of Washington, made me very sad. Mostly the authors responded that if they had followed the advice of their critics, the data would have been biased. If people who are much more smarter than me can answer that about epidemiology, I know enough to talk about it a little bit, but I'm not an epidemiologist, so other people can weigh in on that. But other things that they said were absolute rubbish, as the British would say. Our results are consistent with those of other studies. I'm pretty sure there's not a single person here who would agree with that statement. Small risks should not be ignored. Yes, they should. I got on an airplane and flew across the Atlantic Ocean. That took risk. I could have died, but I came anyway, and you guys are so much better for it too, right? Debates concerning whether the safest level of consumption is 0 or near 0 are missing the point. No, actually, that is the point. That is the entire debate. And so they're trying to say, hey, look, we made some mistakes, but literally it's, just trust us. So it wasn't a good response. The Lancet then did something else. They published another paper that said that the risk thresholds for alcohol consumption were limited basically to about 100 grams per week. Now, I've gone back and forth with Franz on this because I've read different numbers and he's read different numbers. So I came up with a compromise here, and I said that 100 grams per week is about 10 drinks. I don't know. I guess it depends on what you're drinking and what country you're in. It can vary from 5 grams per drink to 20 grams. So it's, they came up with 100 grams per week. Okay, that's a reasonable conclusion to say you should limit your alcohol intake to 100 grams per week. That was somewhat reasonable. Here's what the media did with it. An extra glass of wine a day will shorten your life by 30 minutes. And that was based on this study. The other thing they did was they said drinking is as bad as smoking. And I'm thinking, oh my gosh, no. And going back to that slide we saw earlier, which had all the risk factors, and it was tobacco was number 1, and then I forgot what was number 2, but alcohol was like way down here towards the end. So that's just a ridiculous thing to say. Some of the problems with this paper, the data were actually rather unremarkable. Really, if you're drinking 100 grams per week, there is no health impact. That's what their data showed, period. That was the data. They calculated that if you drank 100 to 200 grams, so that's 5 to 10 drinks per week, you reduced your life expectancy by 6 months. And to that I say, who cares, right? If you are gonna, if someone said you're gonna be 85 years old, that should be your lifespan. I'm sorry, put down that beer or you're going to live to be 84 and a half. I'm going to say, it's okay, man. It'll be all right. So there were also several confounders that were unaccounted for. The authors did properly adjust for age and sex and smoking and diabetes, and you can see the other things they adjusted for, but they did not adjust for diet. Overall diet. They only adjusted for red meat consumption. They did not adjust for exercise or socioeconomic status or race and ethnicity. And in the United States, it's just a matter of fact that white people, Hispanic people, Asian people, and black people all have different life expectancies. And so you cannot make general conclusions about a population without taking race into account. Europeans and Australians also drink a lot more than Americans, so there's a problem right there. We need to address why is it the Europeans have longer lifespan and they drink more alcohol than Americans do. And then the other thing is that the Lancet ran an editorial, and this really got under my skin. The Lancet ran an accompanying editorial that said the drinking levels that are recommended in this study will no doubt be described as implausible and impracticable by the alcohol industry. So there you have it. If you disagree with the Lancet on this, you are secretly taking money from Budweiser or something, right? This is a cheap shot to say something like this. Okay, and this is the promise. The foreshadowing. Dr. Simona Costanzo, wrote a criticism of this, and I'm citing her work. the paper essentially eliminated two groups of people who don't drink alcohol. They eliminated ex-drinkers, which is scientifically valid because a lot of people who are ex-drinkers do so for health reasons. The doctor says if you keep drinking, you're going to die, and they go, okay, I'm not going to do it anymore. So that group, it makes sense. The never drinkers, that's not legitimate to remove non-drinkers out of this analysis. And you can see if you include never drinkers, the beautiful J curve that we've come to expect is still there. But they excluded never drinkers, which is not legitimate. And Dr. Costanzo and Dr. Ostrup and others concluded that thus we believe the study has little to add to existing scientific literature and cannot contribute to public health advice, and I believe they are 100% correct. Okay, the author's response. Never drinkers might differ systematically from drinkers in ways that are difficult to measure, but might be relevant to disease causation. For example, our study found important differences in key baseline characteristics between never drinkers and current drinkers, like sex, ethnicity, smoking, diabetes status, but other differences are also likely to exist. The problem with that is we have this thing called multiple regression analysis that allows you to control for these things. So that's not a good excuse. I don't think that was an adequate answer. Okay, so sort of in closing, I think we have a couple slides left. Data essentially has to make sense in context. Papers cannot stand alone. One paper is just one data point among many data points. And it must make sense in one context, in the context of what we already know. It simply doesn't make sense to conclude that moderate alcohol consumption has an overall negative effect on health outcomes. Of course, and this is a caveat, it's not a recommendation to drink. If you're a non-drinker, then more power to you. You'll be fine and you'll live a long life. But if you like to have a beer or two a day, you're going to be okay too. But that's boring. We already knew that. And if anybody said that, they're not going to get press attention. They're not going to get their story to go viral on Facebook and Twitter. It's boring. No one's going to read it. And so that's how we end up in the mess that I think that we find ourselves in. Another thing, nutritional epidemiology has some flaws. I believe John Ioannidis, Dr. Ioannidis from Stanford, wrote a paper about this, and others have noticed as well that there are some problems because food frequency questionnaires are flawed because people are really bad at remembering things. People don't, as a general rule, don't remember what they ate. I just had lunch, and I didn't even know what some of the things were that I ate. And they were great, but I didn't know what they were. And so if you asked me to fill out a form, like, what were your calorie intake today, I would have no clue. And yet we have nutritional research is largely based on this. We also know that people lie. And this is well documented. People will underestimate how much alcohol, they consume, and they will overestimate how many fruits and vegetables they consume. We know this, okay? Another thing is a guy named Edward Archer crunched the numbers on these food frequency questionnaires, and he found that people would report biologically impossible food consumption. So they would say that if you actually ate this diet, you'd be dead because you wouldn't get enough, vitamins and minerals and things. And so the idea is that there's, that it just needs to be put into context. Food frequency questionnaires are fine, but you have to understand that there are limitations to them. So the conclusion, the truth about food and health is usually boring. The science of nutrition, we've got it figured out for a large part. People aren't getting scurvy anymore or beriberi or going blind from nutritional deficiencies. So we've got a lot of it figured out. But what we know is that it's kind of boring. Be good. Eat in moderation. Eat and drink in moderation. The media doesn't like that, and so they seek out the sensational. I've been trying to fix this for 9 years, and as you can see, I'm an abject failure. So maybe the panel will have some ideas because I'm running out of them. And if you're interested in more about my organization, we don't just talk about beer. We talk about a lot of things that upset people. GMOs, pesticides, agriculture, chemicals, the opioid crisis in America, and a whole litany of other things. And I'm a PhD, we have an MD on staff, and we have a chemist on staff, and so we write about these things, and that's it. Thank you.
Thank you very much for the presentation. Excellent. We see this very often in Europe as well. And I think that your title actually is a perfect illustration of how you can make a provocative title. But having said that, my question is, even though you're referring to the Anglophone, to English-speaking media outlets, we see very much this being copy-paste in a lot of national media. What is your opinion on that? How we can react? How we can also, and we also see that there is no being reactive is just being second. I mean, it doesn't really work. What is your thoughts on that?
I've gotten to the point now that I think that the media is so bad and so untrustworthy. And this isn't a political commentary. Like, I'm not saying, oh, those right-wingers or, oh, those left-wingers. It's across the board. It's bad across the board. I think we may have to look at something like government-funded media that is, the BBC does it, and I know they're not perfect, but the BBC seems to have a decent model. The government funds it, and they just try to go down the middle. There's flaws to that method, of course, but I see that as something that I would like to see replicated in more places.
I just have a comment to that, what you just said. It's not just the media, but also the scientists themselves. In the last study that you mentioned, it was purposely left out all the results in the supplementary that are actually confirming the results that we have seen so far. So it was purposely selected what they published. Though I feel that is a political pressure also on the scientists to publish the right results. How do you see this? How do you feel about that?
I think that having been a scientist and having the pressure of publication, you definitely are pressured to publish and to say something new and unique. And I think that probably is the biggest driver of the problem that we're seeing. That's why I think that we should be publishing more negative papers. They do a research experiment and then lo and behold, nothing worked. Well, publish that. That should be a publishable paper.